I recently paid a visit to a dentist in New York who is an airway-centered dentist, meaning his primary focus, obviously he's looking at teeth, but he's really looking at occlusion, how your teeth touch, how your jaw is positioned, how your head is positioned, to determine whether your ability to breathe through your nose is obstructed or reduced. And the reason is simple, and it ties into postural restoration very, very well. And he's very aware of PRI. I actually met him at a seminar a couple of years ago. If you cannot breathe through your nose and you have to breathe through your mouth, what you're going to do is start to use your neck muscles. And in postural restoration, everything comes back to keeping that neck relaxed. Everything we do with grounding and proper shoes and the hamstrings and the pelvis and shifting into the left hip, shifting into the right hip, adductors, glutes, abs, arms reaching, rotation of the torso, all of these things have to occur as they occur in normal human life before we can't do it anymore. All of these things have to occur so that your neck stays relaxed. The moment you have to use your neck to substitute for lack of ground sense, to substitute for lack of pelvic stability, which you will. Why? Because if your pelvis is not stable, you cannot breathe, you cannot expand your rib cage appropriately. And without that expansion, you can't use your diaphragms appropriately, particularly on the left side. And if you can't use your diaphragm appropriately, you have to rely on your neck to help get air in, to lift your rib cage up. But as you lift your rib cage up using your neck to help you breathe, you arch your back. And when you arch your back gets tense, your neck gets tense, your ribs flare up, PEC, pelvis comes forward on one or both sides, and now you're in the pattern that we were always talking about. The only way to get the neck to relax, therefore, is to sense the ground, be able to supinate, pronate, get the pelvis stable, get your rib cage back into a normal starting position so that you're not extended, get the extension out of your system, get it into a more relaxed state, stabilize the whole body, relearn how to rotate the torso appropriately using proper arm swing, all of this stuff that I talked about millions of times on this website, on this YouTube channel. All of those things are being done so that the neck doesn't have to be used for anything except looking around, looking for danger, right? Just looking around. If you have to use your neck for other activities, now if you're running a marathon, playing a game of basketball, soccer, football, anything, and you have to increase your respiratory rate for a short period of time, like the game that you're playing, and so you start to use your neck, that's fine. That's normal. That's why you have the ability to compensatorily breathe. But you shouldn't compensatorily be breathing with your neck when you're at rest. And that's the problem. A lot of people do not realize that they are breathing more like this rather than getting a rib cage to expand in all directions during an inhalation. You should not see the shoulders do this.
I was irrelevant and forgotten overnight.
You should see this expanding. Okay? Or not even at all. Now, I'm exaggerating that. When you're just normally at rest, it's going to be a very small, probably shouldn't even see it at all because you don't want to overbreathe either. So the breathing that we do in PRI is just for the techniques because we're actually trying to direct air into our rib cage and expand it in certain areas. The point being, if you have to use your neck for anything other than looking around, it creates neck tension and you're going to get pulled back into extension and your neck is going to get tight in that process because these big neck muscles pull rib cages up, and when your rib cage comes up, you arch your back. You can do it at home right now. Put your hands behind your back, all right? Lift up your chest, and what happens? Your back arches. That's extension. That's how people are living. So if you're breathing with your neck, these neck muscles pull up and you just kind of go back into that pattern. So breathing through your nose is absolutely critical. I can breathe through my nose. That's not really a problem. I don't have any obstructed nasal passages. Some people have deviated septums. My nose is not straight, but in reality, it's just, well, I'm going to get to that. But some people have deviated septums that prevent enough airflow from going in. and they have to start to breathe through their mouth too much, and now it's going to cause the neck tension. But breathing through your mouth also does other things. It creates, it can create orthodontal or occlusal issues. Now your teeth can start to shift because of that improper breathing. I would also probably say that the improper breathing will cause probably asymmetric muscle function of the jaw muscles because of the neck muscles pulling on structures of the head that the jaw muscles also attach to. So now the influence of the neck can misposition cranial bones, like the temporal bones, and the muscles that attach to those bones, and thus the jaw, can become asymmetrically activated and now cause dental issues that, again, weren't there to begin with. So I went, and this is what he found, because I just always wanted to see a picture of my head, because what my head used to be like and what my head is now are not the same, not even remotely close. So this is what he actually told me, and this is what's really interesting. First, my palate, my mouth is too small. It's too narrow, in his opinion. He sets 40 millimeters. 40 millimeters. If you don't use millimeters, you'll have to do the conversion on your own. He sets 40 millimeters to be the diagonal, the horizontal distance between top molars. So from my right molar to my left molar, there should be 40 millimeters of space. Otherwise, he considers that a narrow palate. I only have 30, so I'm 10 millimeters less than what he thinks is ideal. Now, not everyone's going to have 40, but he just thinks 40 is the ideal, and not everyone's going to have that, but either way, 30 is pretty small, to the point that I can feel, and this is why people get scalloped tongues. They'll get kind of bumps on the sides of your tongues, on the side of your tongue on either side, because your mouth doesn't have enough space for your tongue to rest comfortably, and that creates tension. But it means your tongue pushes into your teeth. So when you have scalloping on the tongue, it just shows that your mouth is not wide enough. So he said my palate is narrow. He also said that so my tongue doesn't have enough space. Now I also have a slight posterior tongue tie in the back. So, posterior tongue tie. You can look up tongue ties. It's just there's too much tissue, or the tissue is too tight. One of the things that the frenulum, it attaches your tongue to the base of your jaw, I guess, jaw of this area. And if it's too tight, it doesn't allow the jaw to move appropriately. But also, it causes tension. So that means everything. Just think of fascia. Fascia, if it's too tight, there's going to be tension in the system. So that means all the anterior neck and this hyoid bone, all of this area can be too tight if your tongue has a tongue tie that is too restrictive. I'm not going to do anything about the tongue tie at this point in time, because I can get neutral. If someone has a really bad tongue tie, that might prevent their body from getting neutral at all in regards to PRI testing. I don't think that's my issue. Does it create tension? It may. I'm sure it does. It's just something I have to keep in mind. But no, again, I'm 44. I'm not really sure what I can do at this point. Now, the other thing. So I have narrow palate, posterior tongue tie. My right jaw muscles. He hooked these, EEG or EKG pads to my face, and he saw that the muscles on the right side, so my right temporalis muscle, which brings the jaw up, and the masseter and the pterygoid, which is in here, those are really important chewing muscles, masticatory muscles. But they also attach to bones, and when they're and they're really, really strong, some of the strongest muscles in your body. And when they're overactive, they can start to pull bones of your face and cranium out of position. So on the right side, still too active. And I'm going to get to that. So it shows on the left side, it's less active, which means, again, right side over. This is the right TMCC pattern. So right here is still overactive on me. My condyle, so on the jaw, back here of the jaw, that part that goes into the temporal bone, which is the TMJ, it's too far back on both sides, but even further back on the right, which means my jaw is too far back and choking me, at least slightly. Problem is, I got braces when I was young, and they just kind of locked it in. Now my jaw really can't come too far forward, doesn't have any more space to come forward, and that's why a retruded jaw, a jaw that's too far back, so you would have an overbite. An overbite is problematic because it cuts off your airway. Now mine's not so far back that I can't breathe. My airway's open, I can breathe. So that's the good thing. It's just still, in his opinion, too far back. And on the right side, that's what we're going to be addressing. So too far back. And my heart rate variability is low, which is not surprising to me. Heart rate variability, it's not, you can look it up. There's tons at this point written on heart rate variability. You want high heart rate variability. It's believed that high heart rate variability it means you're adaptable. It means your system, your nervous system, your autonomic nervous system is very adaptable to changing situations. You probably have low tension. You probably go with the flow. Like your body can adapt to a lot of different situations. Low heart rate variability means you're not as adaptable. So mine is actually pretty low. Did not surprise me because of my history and of tension in my eyes and the torsion, the cranial situation, the fact that I was stuck in a pattern for so long. Does not surprise me that my heart rate has low variability, but it's better to have it on the higher side. It means your body's more adaptable to changing situations. So that's something, if you like this channel, I highly recommend you research heart rate variability and realize people who are too patterned probably have lower heart rate variability than they'd like to have. Now, there are ways to raise that, and you can read about it, exercise, meditation, all that type of stuff. And then, so what are we going to do about it? Oh, this is the funny thing. I always thought that this tooth was the problem. For a long time, I said, well, this canine is now displaced, and it needs to be fixed. And that's actually why I got Invisalign last summer. But over the past year, I started to think about maybe this thing is actually correct and the rest of my mouth doesn't have enough space. And that's kind of why I went to see him. And he confirmed. I didn't actually bring up the canine. Well, it's obvious that it's displaced. But he said, I don't think the canine is displaced at all. I think that's the only tooth that's actually in the proper position because everything else is so narrow. So what did my brain do? This jaw, the jaw, shifted to the right and came forward to kick out these canines, to create space that had been taken away by my orthodontia when I was a child. My brain knew what it was doing in a sense. It was saying, you are locked into this position. No wonder I had a forward head posture and I was extended for, since I was a teenager, and why my body broke down at such a young age. It's almost like my brain was trying to create space in my mouth so the jaw could move better. Now, why does the jaw have to move? Well, this is why I have to, actually, I'm going to show you a picture right here. Now, this was a client. I did a video on this last year, but you'll see without the splint, so the top picture, without the splint, his jaw is shifted to the right, just like mine was. And that's why the jaw that's shifted to the right, because you can see his bottom teeth are shifted to the right. So that's his jaw has shifted to the right. When someone has a jaw that's shifted to the right, that's not the normal pattern. I'd prefer to see a jaw slightly shifted to the left because that's normal if you're on your right leg. So this is my right side. If you're on your right leg for too long, this right SCM becomes overactive, well, along with the rest of the neck musculature. But it starts to pull on the temporal bone on the right side, and it kind of sucks the temporal bone in on the right, and when that happens, it pushes the jaw slightly forward on the right, so the jaw comes forward, but it also has to turn to the left slightly. So that's just normal mechanics of someone who's on the right side for too long. Their jaw shifts a little bit forward on the right and to the left, so it just shifts to the left slightly. That's the important part. When you're on your right side, it's just telling me that that person is overactive on their right side. They don't use their left side enough. When they get to the left side, the jaw will move to the right. And that's part of PRI technique sometimes. But I have no problem seeing a jaw that's shifted to the left. If I see a jaw that's shifted to the right and I know they're in a pattern, that's a problem. And that's where I get concerned. That's why I'm always scanning for faces, because I know that that is an abnormal position. That is often indicative of a cranial twist, and that's where things really start to become difficult. So when this gentleman had his splint in made by a dentist, you'll notice his midline straightened out. So how did that work? Well, the splint itself is deactivating overactivity of the jaw muscles, and the jaw now shifts slightly. The problem becomes, uh, can you get a new permanent jaw position back centered if your teeth have already been kind of locked into place? Like, actually, I don't even know exactly what happened with him. I haven't heard from him in a while. I don't know if his jaw actually. So, what you'd want would be take the splint out and still have that bottom picture. I don't know if that ever occurred with him because I haven't spoken to him in a while. But that's ideally what you want. Or the problem is, if you take the splint out, does the jaw automatically go back to the right? So when I was speaking with the dentist, he said, I'm going to get a splint. And I had a splint years ago, but the problem was it wasn't made by someone who actually knew what they were doing, because I didn't really know what I was doing. I just knew I just needed it because I was a torsion. That's the importance of having something made by someone who understands this, and you are guided by someone like a physical therapist who does understand this and can give a little bit more direction to the dentist if the dentist doesn't understand it, is paramount. And there's so few the people that do understand it, and I understand the predicament. But so what he told me was that he can make the splint so that it brings my jaw forward a little bit and to the left. So it has to come forward and to the left, because remember, my jaw looks exactly like his. Midline is slightly off to the right. I already knew it. I was looking at it, but I was hoping it wasn't making a big difference. But it makes a difference, and I know this. So the splint will bring my jaw forward a little bit and to the left. That's the plan. And he said, after time, you have to wear it for quite some time, and he believes that over time my brain muscles will relax. This right side will probably relax. The right TMCC muscles will relax. The jaw will move into a different alignment, a more optimal midline alignment, because we can move it to the right position. It's just a matter of, will the brain accept it as a new position to keep it there permanently? That's the question. And he also said, because at rest your teeth don't touch, or they shouldn't. No one should be resting like this. All right. When you're at rest, your teeth should not be touching. They should really only touch when you eat. And they should only then, when you sleep, they're probably going to touch also, just because you don't have control of it at that point. Sometimes your brain muscle activity occurs at night that you're not aware of. You're not doing it on purpose. It just happens. So he said, because my teeth shouldn't be touching, because I thought, well, how is that ever going to change if my teeth already locked me into place? Because teeth shouldn't be touching that often, except for chewing and at night when you sleep, if they touch. But I'll be wearing the thing at night, so it'll during the day I can become aware of it, and I know I won't have my teeth touch because they don't touch when I talk, and I'm aware of this. But when you're chewing, they do. But he said it should be enough, and I have enough space in my mouth still, that we should be able to get the jaw into a slightly better position so that the midline is more lined up. And what should that do? Well, I know when I bring my jaw forward and slightly to the left to align my midline, to align my mandible to be in line with my maxillary teeth, the top teeth, I can actually feel this temporalis muscle on the right side work differently. I can feel relaxation of these bones up here. And when I'm walking, if I do that, I can feel my body rotate to the left more easily. And then it's very subtle, but I'm just very in touch with my body. It's very subtle, but then when I let it go back to where it is now, I can feel the rotation into an improper position occur again. It's probably so that rotation is what still gives me some tension when I walk. But chronic pain, no. I mean, my life is infinitely better than it was before. I just, every symptom of everything I experienced for so long is so drastically reduced. There's just no comparison. But my back does start to hurt sometimes. But again, it goes away. And I know what it is. It's just tension that's still occurring because of something that was up here, the cranium. It wasn't a muscular issue, it's just the tension builds through the neck. So if the jaw cannot move freely, neck tension increases slowly. And then by the end of the day, in the mornings, I can walk, no tension whatsoever. I feel great. But by the end of the day, as I'm using my eyes more, and remember, the more you use your eyes, the more tension will probably be in your neck. Necks get tight, they start to get tense, they start to have this chain reaction, like I talked about. And when I walk at the end of the day, I can start to feel tension in my mid back, particularly on the right side. Again, it's not terrible, but I'm also hoping that this will help lower tension so that I can sleep a little bit better. May or may not work, but that's where I'm at. And hopefully, if you need help with this type of thing, again, Google airway-centered dentistry. Airway-centered dentistry. You can read about it. Maybe if you're in the United, I don't know what, I got a lot of international people. You can type it in airway-centered dentistry and see if there's anyone in your area or if they have a similar profession in whatever country you're in. I have no clue if it'll help you. It's just something, at least these dentists are aware of these issues. They may not understand PRI and they've probably never heard of it, but it doesn't matter. They can sometimes, I have a sneaking suspicion that some people that I've had no success with, particularly online, because when I'm with people, I can be like, hey, your neck is just not moving. And I'll have to refer them out. But online, it's harder to do that. So I have a sneaking suspicion that some people that I have worked with online, and I look at their teeth, and sometimes like, man, their mouth does look small to me, but they say, yeah, my dentist says I have perfect teeth. Well, those teeth might be perfect, but they might be perfect on a narrow face or a narrow palate. And what they don't realize is that narrowness is creating tension, and it may create so much tension or a tongue issue that doesn't permit them to relax their body enough to feel their muscles properly, and they can't get their test to change. So hopefully this helped and gave you some idea of why narrowness of a face, narrowness of a palate can be problematic because it leads to overactivity of the neck. And if your neck is overactive, you get pulled into extension and now you're back into the pattern, or you can't get out of the pattern. So if you like this, please like it, share it. If you think it's important, other people may need to know about it, share it. And have a great day. Thanks.